Welcome to the Hennepin Region's Psychiatry Training Program. We are a 4-year accredited program training at 2 diverse tertiary care hospitals in the Twin Cities community, both with a demonstrated commitment to the region's safety net patient population. We also train in multiple community clinic sites, including assertive community treatment teams. We pride ourselves on the diversity of our patients and training sites, and also of our residents. Since 1996, we have launched the careers of over 80 psychiatrists, more than half of whom are now serving in our Twin Cities community. Later, we'll introduce you to a few of them and let them tell you what training at Hennepin and Regions has done for them.
Psychiatry residents train at HCMC's single-site campus, which spans 5 city blocks in downtown Minneapolis and houses inpatient and ambulatory services. HCMC is a Level 1 adult and pediatric trauma center with Hennepin County's highest volume emergency department. HCMC also operates a recognized system of primary care and retail clinics throughout Hennepin County. Our psychiatry unit has 102 beds, and our acute psychiatric services department is staffed 24 hours a day to handle individuals in crisis. Our hospital has more than 42,000 crisis calls and drop-in visits and 25,000 psychiatric visits annually. Our outpatient services for individuals of all ages include adult psychiatry clinics, a women's mental health program, mother-baby program, and child and adolescent clinic. Lastly, we provide addiction medicine services and clinics.
Regions Hospital was established in 1872 as St. Paul's City and County Hospitals. We are a Level 1 adult and pediatric trauma center located in downtown St. Paul. We serve as a primary safety net hospital for patients in the St. Paul area. And we are a teaching hospital for residents, medical students, and other healthcare professionals. Psychiatry residents train in the new state-of-the-art mental health facility, which provides a calm, supportive atmosphere for patient-centered care. With 100 inpatient psychiatry beds, we are one of Minnesota's largest providers of mental health care. Our new mental health building was completed in December of 2012 and features private rooms for all of our patients. Regions Hospital serves St. Paul and its surrounding communities in Minnesota, western Wisconsin, and across the Midwest.
I remember as I was leaving the hospital after a day of interviewing, and there was a gentleman who opened the door for me, just some random stranger. And I turned back to Ellen and I said to her, if I meet one more nice person today, I might not want to leave, not even come back, in the time it takes to interview. And so that's what I remember most about my first meeting with Minneapolis and St. Paul. When you're so far away from home, I'm from New Delhi. When you're thousands of miles away from home and you're going to shift gears and be away from your loved ones, you want to be in a place where people are nice to you. And so that's one thing that really struck out to me. That was very welcoming. They were very, very kind and sweet, and that hasn't changed a bit. I still feel this is one of the most welcoming places in the parts of the world that I've been to.
Actually, my first experience with the residency program when I was actually an intern really let me know that it was a family-oriented program. I had graduated from medical school, and my graduation was in New York, and it happened to be the night before the residency program started. So I was caught in a bind because my family members were all in New York with me, and Mary Barraclough offered to pick me up in the morning. So I took a red eye that night home to Minneapolis, and Mary was at the airport waiting for me, picked me up and brought me to where I needed to be that day. And from that point on, I knew I was with family.
The learning process, as right from when you start out as an intern to second year to third year, it's a very steep learning curve. But when you have such wonderful staff who, are so nurturing, they absolutely brought out the full potential in me. Even I didn't know I was capable of.
Probably the most memorable one was probably the first day on the unit. I mean, that's usually somewhat of a shocker because it's the first time you're in a place where you're actually expected to care for patients. And I just remember all the staff were extremely helpful. They were always eager. I remember Dr. Pearson, a number of other ones, they were kind of there and wanted to show you everything about psychiatry. And I remember this one patient that was just floridly psychotic, and they were sitting there and just pointing out all the different traits, all the things that you should be looking for in a patient when you came onto the unit. And, you know, in contrast to training on the East Coast, this was really kind of foreign, where you, on the East Coast, you got basically brought into a situation, and then you were kind of just constantly tested, versus someone that was that open and genuine and wanting to actually teach you what the process was. What did you need to look for? What did you need to do?
I think the faculty is so diverse. Right from, I mean, we have attendings who are here from Scotland, and we have Dr. Heath with his wicked British accent, and we have Dr. Tipnis with his cracking sense of humor. It's just so culturally diverse as far as the attendings are concerned.
It's a diverse population. In South Carolina, you had white, black, occasionally a Hispanic patient. Here, you're talking about Somali patients, you're talking about Hmong patients, you're talking about Eritrean, Ethiopian, just a whole gambit, Russian, you name it, and working with interpreters and different things like that. When I found out about the diversity associated with the Twin Cities, that's when I became really interested in the program.
At this level, we're all very knowledgeable of medicine, but only through experience do you gain the understanding and learn the intricacies of the human brain and your patients.
Dr. Reeve did not believe in shielding the chief residents from the inner workings. We were right up there at the front lines with her. She treated us like deputies, and she really helped us. She exposed us to the challenges involved, and she helped us through them. So it was a very hands-on experience, and there were all kinds of experiences with the other residents. Some of them were challenging, some of them were warm and affable, but we really got in there.
First, to clarify, when I entered residency, I was like, this is it. I'm going to do my 4 years and practice as an adult psychiatrist. I had no intentions of doing a fellowship when I started here. But then comes second year, which is our outpatient year, I start, like other residents as well, I started my child psychiatry clinic half a day a week for the entire year. And that was with my mentor, who I absolutely adore, Dr. Elizabeth Reeve. So it was going through her clinic, which was, it's very structured. She puts in so much effort in teaching you. There are times when she'll stay until 7 and 8 in the evening to make sure that your patients have been discussed and all your questions have been discussed, and at the same time, just making sure you sort of learn the nuances of child and adolescent psychiatry.
A lot of times people we're all nervous and trying to learn everything, and in this program they give you a lot of autonomy and let you learn. They guide you. They're not necessarily telling you how to treat a patient. They're there to support you and to nurture you and help you learn from both positive and negative experiences.
Because of the breadth of experiences you have, because you get a chance to work in community settings, in legal settings, in psychotherapy settings, psychodynamic psychotherapy settings, ranging from all kinds of psychotherapies and all kinds of outpatient and inpatient settings. Really, after you're done with the training, the world's your oyster.
Thanks for your interest in the Hennepin Regents program. We look forward to meeting you soon. I hope you will consider joining our team.